Dear colleagues, let me introduce you the results of our evaluation about the early detection of prostate cancer in young men. As you know, the prostate cancer epidemiology is very fast for the prostate cancer, and it is about the first place in Europe due to incidence, and about mortality from prostate cancer. It's about third place in Europe. What about Russia? The data about Russia is not as so either well known in Europe or in America, so we can speak about official data of 2015 when it was more than 38,000 new cases of prostate cancer and about 12,000 cases of death of prostate cancer in our country. The largest average annual increase in the incidence of prostate cancer is about not more than 7% from 2005 2015, and the temp of increasing you can see the slide. What are the main problems with the prostate cancer all over the world and in Russia also? The increase in the incidence rate is about 6% over 10 years, as you saw at the previous slide. The mortality rate is about 3% annually, and a late detection of this oncological location is about 20%, which we see at the autopsy. What about the main factors of prostate cancer in the world? It's a burned heredity, it's a race. All of you know about Afro-Americans who have very high incidence and mortality of prostate cancer. The diet and metabolic syndrome, which is very important for also for the people of 40 or 50 years old. The contingent about what we shall speak a little bit further. Well, medical therapy and concomitant pathology. When we say about the early detection of the prostate cancer, we can speak about the genes associated with PSA level as a well-known method of diagnostic of prostate cancer all over the world. We can say about the BRCA2, which is more than 40% in all of these cohort of patients. Others, BRCA1, ATM, and other mutations are very important for early diagnostic. So what about the group of patients earlier, younger than 50 years old? Well, the annual increase of incidence in that group of patients is about 2%. Is it very high or very low? I don't know, but earlier we have said about the group of patients older than 80 years old. And distant metastases in that group of patients are detected 6 times more often under 40 years old. And early development is due to heredity with a dominant in the male line. Well, the 5-year survival rate in that group of patients decreased to 80% in ages younger than 40 years old. And there is no standardized algorithm for early diagnosis of prostate cancer in that group of patients. It is very important to know about the role of inflammation in genesis of prostate cancer and also about chronic prostatitis, which we find in many patients, of male patients earlier than 50 years old. It was observed and upfront by Roburn in 2006. We can say about prostate intraepithelial neoplasia, and if we find it in species after biopsy of the prostate, we can say about very high risk, about 50 or 80% risk of development of prostate cancer in the future development. We can say about 3 phases of pathogenesis of tumors, including prostate cancer, and you see that the initiation, promotion, and progression of prostate cancer, which we can see in many groups of patients, also in the patients of 50 years old or earlier. So the target of our evaluation was to assess the modern possibilities of early detection of aggressive forms of prostate cancer in young males based on the study of immunohistochemistry indicators. The main research objectives after performing the immunohistochemistry may be the correlation of molecular science of prostate cancer with ecological, geographical factors of their living, diet, heredity factors, results of beam and other kind of diagnostic. Then to assess the reproductive potential in young males with prostate cancer. And at the end of the study, we shall develop an algorithm for clinical and morphological diagnostic of young males younger than 50 years old, with malignant tumors of the prostate gland. Well, about the materials and methods, we observe the group of patients, 120 patients with prostate cancer in different age groups from 40s to 65 years old, and determine them into different subgroups according to histological evaluation. So adenocarcinomas, intraductal cancers, different others, sarcomas, and so on. Well, about materials and methods, we perform immunohistochemistry study on 10 prostate cancer samples of patients from 40 to 51 years old in the studies of PT1 to PT2C after radical surgical treatment in one clinic. And it was the study carried out as a part of joint research of 2 Russian universities from Moscow and St. Petersburg. Preoperative PSA, as you see, from 3.5 to 9.8 with differentiation to 3 main groups according to pathological classification, as you see at the slide. All of those patients performing robot-assisted radical prostatectomy without any technical features and postoperative complications. As a result, we saw the tumor, the apex of the prostate gland only in one case, and tumor in both lobes in all patients without any perineural lymphovascular invasion and urethral lesions. Well, positive margin of surgical resection was only in one case, about 0.2 centimeters long. About immunohistochemistry, we perform a different evaluation of Ki67 and founded it in 1 to 5% of samples. With beta-catenin, only 3 points with membrane staining up to 100%. e-catering from 1 to 3 points, mainly in patients with PT1, ISOP1 group. And we didn't detect any EGFR TP53 in BCL2 mutations. Also, we have found the loss of heterozygosity of PRCA2, RB1 and PTN in different patients, mainly at the stage of PT2C, PT2A, PT2C, with histological classification of from first to 3 groups. There were 1 PRCA2, 1 PTN, 2 PTN, and 1 RB1 mutations. So we can conclude that the diagnosis and treatment of men younger than 50 years old with prostate cancer are of great medical importance. That is lack of samplings among young men, as well as the high cost of proposed genetic studies. So we do not perform that special laboratory diagnostic to all cohort of patients in routine practice. We plan to compare the obtained results of immunohistochemistry with the further fate of the observed patients, indicated of the overall and cancer-specific survival, frequency of medical consultations, association with PSA, and the results of the study for the group of control, the patients older than 50 years old. And the study of combination of risk factors for the development of prostate cancer in young men will allow us to formulate a new diagnostic algorithm for that group of patients, for the males younger than 50 years old. It's very important in our future, for the future of such young men. At the end of my short presentation, I want to thank you for your attention and welcome to our city, to St. Petersburg, in every season, in every weather. Thank you for your attention.